So my name is Holly Farbo. I am the Senior Academic Manager of Hygiene. I work specifically with hygiene schools and students, and I talk to them about a career at Aspen Dental. I'm a dental hygienist, 21 years. 19 of those years was in private practice. I did work in an Aspen office for a year prior to coming to the academic team, and it was honestly the best job that I ever had. I loved everything about the way that we saw our patients, and I became a huge Aspen advocate. So whenever I was presented with the academic job where I got to speak to students and get some of those misconceptions put aside, it was like my dream job. So Aspen has really provided me a lot of opportunity in career growth. So that's where I'm at right now. And then we're going to go to Tiffany next. Tiffany, go ahead and introduce yourself. Tell us how you got to Aspen.
My name is Tiffany Nugent. I have been a dental hygienist for probably 16 years. I've worked in private practice, dental service organizations, including large group practice, and then owned by nonprofit and for-profit. One thing I loved about Aspen when I was first introduced to Aspen is their model. I just thought it was brilliant right away. It's centered around just like healthcare is set up, and it's what we were taught basically when I go back to the basics of hygiene school.
Great, thank you. Alexa, go ahead and introduce yourself and tell us how you got to Aspen.
My name is Alexa. I've been a hygienist for about 10 years now, which flew by super fast. I was in private practice for about 8 of those years, and then the last 2 years I've been with Aspen and Bismarck, and we were looking to make a move, and Aspen, just from the moment I talked to everybody, was very welcoming and answered all my questions, and it's just been the setting that I've been wanting to be in, and it's been good.
Great, thank you. So first what I'm going to do is I'm just going to explain a little bit about what a DSO is. We use that word DSO, and some people aren't aware of what a DSO is. So basically a DSO is a dental support organization. And what that is that for me on the ADMI, there's Aspen Dental and there's Aspen Dental Management. I work for Aspen Dental Management, and we are the support for the offices. So basically our offices are owned by a dentist, and so they have full autonomy for the hygienist and the dentist to do a treatment plan that they see fit. They manage their office, they see patients and deal with patient care, and we on the management team support side do everything else. So an example is if a dentist got out of dental school and wanted to start their own practice, they would need to find an office, and a lot of times they would have to hire somebody like a realtor or somebody in that scheme to find them a place. And then once they got in there, they would have to set up their office with their computer software and all of those things, and most likely they would hire somebody to come in and do that, set up the software. Then once that happened, they would have to hire their employees. So hiring and interviewing, doing all of that, recruiting employees, and then getting patients and marketing and, trying to build their patients. And some offices, dentists, they don't get patients, and then they sometimes bring on a consultant to try to get their patient base up and see what they can do. So that's another person they would have to hire. Insurances, healthcare, all of those things that are usually taught in dental school, dentists sometimes struggle with once they get into private practice. We do all of that. So that's our job in support. Everything non-clinical, clinical is left up to the hygienists and the dentists in the office. So just a little backstory on what a DSO is, because I know there's some misconceptions on corporate dentistry and and what we are. So let's start off with a question that's asked. Why would I leave my private practice job after 12 years to come to a DSO or Aspen? Tiffany, you want to take that one?
Yes, that's a good question. So we want you, right? You have good experience. So there's a few things that maybe private practice does not offer that Aspen might offer. So as Holly said, as a DSO, we support the team on maybe the logistic side, but clinical, it's always up to the clinicians. So one thing is I would ask, does your office guarantee your hours, guarantee your wage, guarantee your days? Aspen does that. Another thing that Aspen Dental does is we provide healthcare benefits. And because we're a dental service organization or support organization, we can be competitive, right? Because there's so many offices that are separately owned by dentists, but together we're a large team. So we can negotiate with insurance providers to get the best benefits for employees. So does your doctor offer you benefits, paid vacation, paid sick time, paid holidays? Does your doctor offer you tiers of healthcare plans, including dental, insurance, or long-term disability, short-term disability, life insurance? So when a dental service organization partners with a doctor that can't do it all, they're doing dentistry, they can't do another job, they're only one human being, that's what Aspen's going to offer you.
Great, thank you. So Alexa, I'll ask you this question, and it always comes up as far as compensation. And one of the biggest misconceptions is that you get paid on commission. So do you get paid on commission?
I do not get paid on commission. I get an hourly wage. And I just feel like I don't feel like I'm need to sell things. Like nobody has ever made me feel that way. I just give the patients what they need, and treatment plan is based on everything that patient needs. So I've never felt like I need to sell anything to get a compensation, so we just get an hourly wage.
So going to the selling, since you brought that up, that's another thing that is a misconception, is that we have to sell products.
Right.
What types of products are you offering your patients, and why?
So, I mean, we offer them 1.1 prescription, Stannis rinse, chlorhexidine, dry mouth gel. There's just so many things that we can offer our patients. And I never had access to all of those things in any other practice I've been in. So I think it's pretty awesome that our patients can get all of those things that they need. Dry mouth gel, we do Arrestin, Atrodox if they need that, electric toothbrushes we have in stock all the time, so they can take them home that day if they need them. So, yep.
Great. And so another misconception is that we're expensive. We actually are the number 2 customer of Henry Schein, right behind the United States government. So we are we're their biggest customer behind the United States government. So that's means we get really good prices on our products. So, that's one thing I just wanted to throw out there. So Alexa, in your office, how many hygienists do you have?
So we currently have 3 hygienists, so myself and 2 others.
And how does the flow of your office, what is a typical day like? And are you required to see a certain amount of patients per day?
We are not required to see a certain amount of patients, but we obviously like to be as busy as we can. So we work pretty hard on filling our schedule and keeping it full. So a typical day would be a couple prophies, and then ideally some scaling and root planings, and then we also go in to see our new patients and do perio readings on them as well in between patients. Get some kiddos in there. We rocked out some sealants today, so
Yay, that's good.
Yeah.
So Tiffany, on the support side, because this is part of the support of Aspen, what is your role as a territory hygiene manager in supporting the hygienist in the office?
So I'm a dental hygienist myself with multiple years of experience, but after a while of working chairside, I wanted to be challenged in a different way. I've trained dental hygienists. I want to mentor dental hygienists and help them grow in their careers. So for instance, Alexa calls me with an issue and I help her solve it. Or if I can't solve it, I look for resources that can help her solve it. So my role is to support the clinicians, whether it's the hygienist, to make sure she feels valued, or he or she feels valued, and also the doctor.
And I will say Tiffany is really good at what she does. So it's really nice to have like that support system, because that's another thing I never had in the past. So it's nice to be able to reach out to somebody like for something I don't know the answer to, and to just have that support and feel like somebody has my back all the time. It's nice. So.
Yes, I will agree. Tiffany is great. I have worked with Tiffany personally, so yes. So your new patient exam, Alexa, we do our new patient exams, at least in my experience, differently than a private practices that I've worked in. So go over a little bit about our new patient exam and how we do that.
So we see the new patient and do all their x-rays. We typically tell them that we will do their cleaning if we have time, but they are not scheduled for their cleaning that day. But we gladly would see them if we can fit them in. And then we go in, take their x-rays. The assistant takes all their x-rays and everything. And then once they're done with the x-rays and their dental health scan, I come in and perio chart. I go over their dental health scan, look at the tissue, and then diagnose like gingivitis or periodontal disease and talk to them and just really spend that time educating them about what's going on in their mouth so they can make those decisions for treatment.
Good. And what type of tools do you use? Do you have an iTero machine in your office?
We do have an iTero, and it is my best friend. I love that thing so much. So for people that aren't familiar with the iTero, it's a 3D scan of your mouth. So we take 3D scans on all of our patients. We call them dental health scans, and we show the patients what their mouth looks like, because most people can't see inside. So they think it's pretty cool because they're like, oh, what is that? And they start asking questions. You know, they might see a broken tooth or a cavity, or I can show them all their calculus, and I can show them that their gum tissue is red and inflamed. And so that thing is amazing.
Yeah, it's great.
Yeah.
So Tiffany, I work with students. So obviously a lot of them their question is, do we hire new graduates? Number one. And that going off of that, their biggest concern when they do go into an office is because they've had usually 4 hours for a cleaning. And so they're really afraid of being able to just be put into an office where they're thrown into a schedule of patients without any, support. So how do we, again, number one, do we hire new grads? And if we do, how do we train them or ease them into, an office?
Yes, we do hire new graduates, and it does not matter if you're a new graduate or you've been doing dental hygiene for multiple years. We want you to go through a training program so that you feel comfortable before you see patients. Our training program used to be 10 days. We have now extended it to almost 3 weeks of training. The first 10 days is with a hygiene trainer like Alexa, who's trained hygienist, and then online or virtual courses. And then the last week is I try to come to your office and work with you to make sure you feel comfortable and enroll. And because I have a hygiene license also, I can help support you if you get behind, if you need a room cleaned, or you have any other questions. So we don't I've been there in my career where you're just thrown into an office. We don't do that no matter if you're a new grad or a seasoned hygienist, but we do hire new graduates. And I guess I would argue that as a new graduate, you're fresh. You've learned just what school or the top of the tier from the ADA has taught you, and that's not necessarily a bad thing, because you know nothing else about maybe bad habits in different offices. So I don't think we make a difference between new graduates and seasoned hygienists.
Yes, and I will attest to that. I mean, I was a seasoned hygienist at 19 years. And, you know, when I walked into the office, I feel like I lost a lot of my skills over the years that I wasn't able to use. I was kind of, you know, told what to do or what not to do. And so when I came to Aspen, I learned a lot from the person who trained me, who was a, you know, hygienist that had been less years than me. But, you know, I actually had to relearn how to treatment plan and really diagnose perio, because it just, you know, unfortunately it gets undertreated a lot. So yeah, and I benefited from that. So just real quick, Tiffany, you want to talk about the HOP program, and what that is, and how and when we do that?
Yes. So HOP, before COVID-19, after a hygienist had been trained with her trainer or his trainer, we used to send the hygienist to Chicago or New York for additional training where you could work with your peers. However, due to COVID-19, we're doing more virtual training. So Aspen Dental modified their training program, and they're incorporating HOP into the program. So when a hygienist is hired, the first 2 days and then the following 10 days, you sit with a link, and you just like the Zoom meeting, you work with your peers, you talk about issues that are happening in the office and give feedback on how you can improve a situation, stressors that are happening in the office, or anything else that's going on. And then as I said, then the last third week of training, typically now you're with a hygiene mentor. So it's slightly different than how it was, but we have to modify, right? The world's changed now due to the pandemic. So.
Right. And I'm glad you mentioned that, because COVID-19 has been a big issue, and a lot of my job boards that I see, hygienists in other offices, they're overwhelmed. They don't have enough PPE, or they haven't had enough PPE. So Alexa, for number one, do you feel safe in your office? And, you know, do you have enough PPE, and how has the patient appointment changed due to COVID?
Mm-hmm. Yeah, so I do feel safe. I was on maternity leave, and so when I came back, I was nervous to come back because I was in my own little bubble for a while, but everybody, like I said, made me feel really safe and supported. And I think I called Tiffany a couple times, and she always, you know, was really supportive, and we made me feel like I was going to have what I needed, and I did. When I came back to work, I have an N95 mask. I got fit tested for it to make sure that it fits correctly. And we have all the proper PPE we need. The appointments with COVID have changed a little bit. So we have more PPE to wear. So now we have, you know, the gowns and a face shield, as well as our N95. And then we're using our HVE when we're using ultrasonic. But really, I mean, it took a couple days to figure it out. Now it's just second nature. So
It's starting to become the new norm. And plus, you know,
yeah.
we use universal precautions as it is. So I think that the dental community has really shown that that's true, because very little transmission has come there. So that's great. Now, for when you order your supplies, Alexa, who's responsible for that? Are you able to order the supplies that you want? How does ordering for you work?
Yep, so I do most of the ordering for our hygiene team, and we kind of discuss when our order is due. We kind of go over it, and so if they need anything that I missed, we just make sure we have everything we need. But we can pretty much order anything that we feel like we want. For example, we were using Orikix, and one of the hygienists was just in Fargo temping, and they use Cetacane there to do some topical numbing, and she really liked it, so we're going to give that a try. So I mean, we can kind of order what we feel like we need whenever we feel like we need it. So
Good. Now, Tiffany, for a new person who would, wants to come on to Aspen, what is the process of hiring? How do they go about applying for a job, finding a job, and then the process of the hiring? Can you talk about that a little bit?
So there's a few ways. You can go to Aspen's website, www.aspendentaljobs.com, and apply that way. However, because hygienists are a provider and they're valued and hygienists are in high demand, if you reach out via to someone that knows someone at Aspen Dental, or call the office up, or reach out, email my way, or call any way possible, we will bypass that system. We just need, first we do a phone screening to make sure you have clinical competency, or that you're on board with our model and what you stand for, what you care about with patient care. And then after that process, which is only 10-15 minutes of conversation for the phone screening, I typically set up an interview with the doctor owner and the regional manager. And then you come in person, you bring your resume in, or I've emailed it to them if you have emailed me a resume. And then they show you the office, show you the patient flow. And then obviously you just as much as the doctor's interviewing you, you're interviewing the doctor, right? That's your team that you're potentially going to work with. And then after the meeting, they may or may not offer for you on the spot, or then I'll reach back out to you with an offer, or just at least I would like to know, right? If I didn't get a position that I went to interview for, I would like to know if I didn't. So anyway, the form of communication the process will be gone through.
Perfect. So in the office, Alexa, who does the x-rays? Like for the new patient, who does the x-rays? Who does the scanning with the iTero machine? And, how does that work?
So in our office, mostly the DAs do the x-rays for the new patients. They're primarily taking the x-rays and they're primarily doing the scans. However, any of the hygienists will help them out when they need it, just so we can, stay on time or help out where it's needed. But the DAs are primarily doing x-rays and the iTero scans.
Okay. So when you do your treatment plan, do you ever refer out? Are there certain times where you would send a referral out for a patient for either Perio or any other services?
Oh yeah, for sure. So we do quite a bit of Perio referrals, just for Perio that we feel like we can't treat in our office. If it's really advanced Perio, people need like bone grafting, things like that, then we would refer out. So.
Perfect. What are the office hours like? Do you guys work extended hours? Do you have Saturdays? And I know each office is different because, like I had said before, that the offices are owned by the doctor. So Tiffany, is that up to the doctor to make the office hours, or do we have a typical type of schedule we like to abide by as far as access to care for our offices?
Both. So because our mission is access to care, we offer extended hours. One day a week, we usually work late as a clinical team to 7 or 8 p.m. at night. However, you come in later on in the day at that time. And then your Friday is a half day. We do like to offer half day Saturdays, one day a month to patients, because again, our mission is access to care. And if you're a working adult, especially with kids, how do you do it all, right? However, that's not a deal breaker. Alexa, for instance, has a very busy family life, and she works a certain amount of days, but then she doesn't work all the days. And that's why we have multiple hygienists in the office to cover different days. So it would not be a deal breaker for a hygienist to reach out to Aspen and say, this is what I'm looking for. Can you work with me about it?
So do we offer part-time positions, or can you talk about the floats and what's that?
Yes. So we offer full-time positions. So for full-time for Aspen, it, it is 30 hours or more to get healthcare benefits, including vacation and sick time and all the benefit package that is included. So 30 hours would typically for a hygienist be 4 days a week. And it doesn't matter, we could work with a schedule on what day you have off. Of course, we like to try, just because it's nice to have for a hygienist, weekends, right? To do, like, you have Monday off and a 3-day weekend, or Friday off and you have a 3-day weekend. But we're also open to part-time. Alexa's first associate hygienist that came on with Bismarck is also a working mom, and she just wanted a certain amount of hours. So she works just a few days a week. And then we are open to float positions also, or fill-in positions too.
Okay, good, perfect. So Alexa, other than cleanings, what other services do you provide as far, in hygiene? What other services do you do in the office?
So we do periodontal therapy, so it's your typical scaling and rip cleaning, and then we do gingivitis treatment as well, and then we do the dental health scans and sealants and fluoride treatments. So
Perfect. Did you say whitening? Do you guys do whitening
and bleaching? Yes.
Bleaching? What system do you use?
We use Zoom, and I love it. It's by far the best system I personally have ever used. So I see great results, and so do our patients. They're always ecstatic when they leave. So
Perfect. So a lot of the hygiene students that I work with also, their big priority is giving back to the community. They do a lot of community outreach programs. What type of community outreach programs does Aspen do or participate in? And either one of you can answer this if you'd like.
So Aspen has multiple community outreach programs. One is they do a mouthmobile that travels around the U.S. And another mission we have is to take care of veterans. So we cater to veterans, and the mouthmobile comes around. Anyone from the clinical office, when the mouthmobile is around the area, can volunteer, and we treat veterans for free. Another mission we have is access to care overseas. So at least once a year, doctors have a team that volunteers and goes somewhere overseas to a third world country that doesn't have access to care. And dental hygienists, you apply for it, right? Through Aspen. However, they pay for your services that you're volunteering for, your meals, your hotels, and all that. The other way we do mission, again, we cater, or we're concentrating on veterans. So one day a year we do a service day for veterans, where they take someone that's been in the service, and typically, right, when you've been in the service, sometimes you have other mental health needs that might limit to what you're caring for your hygiene, and the treatment might be at that time a lot. And so what they do for veterans is you get that access to care for free.
Good. Yeah, I used to love to do the day at church service. That was one of my favorite things to do.
it's a lot of fun, and it's like really rewarding as well. So
It is. So Alexa, in the office, and again, a lot of the hygienists will ask me what type of software we use, Dentrix or EagleSoft or digital x-rays. Can you explain a little bit? I mean, we have our own and how that works.
yeah, so EPMS is Aspen software, and it's pretty similar to EagleSoft or Dentrix, just a learning curve like every new software you're going to use. But it's pretty easy to get used to. So pretty just like the charting and the teeth, and then your perio charting, and pretty similar to any other software.
And as far as your I lost my train of thought, guys. Hang on one second. I was talking about EMS. I'm sorry. EPMS, as far as, oh, the bridge is what I wanted to talk about, the bridge. Can you explain a little bit about the bridge and what kind of services, like, and what kind of resources are on the bridge that we have and what the bridge is?
There is so much stuff on the bridge. I mean, it's just like your one stop for everything that you ever need. So there's all of our consent forms are on the bridge. Anything with HR, phone numbers, emails, for even like Tiffany, you know, anybody's numbers, all of our vendors are on the bridge. Our metrics are on the bridge as well. So just an abundance of good information on there.
Perfect. I know. That's great. So since you mentioned the metrics, you know, sometimes people get a little bit scared about anytime you mention goals or metrics or anything like that. I personally love the metric system because to me, it was like my own little personal goal thing to look at every day and make sure that I was doing what was right by my patient. So Tiffany, can you just explain a little bit about the metrics and why we use those and what exactly they're for?
Yes, so on the bridge, our own internet system within Aspen Dental, we do, if you go under there, as Alexa said, there's multiple things on there. If you need to know about 401k, you contact on the bridge a certain area for HR, but there's also a certain area for hygienists. And if you go to that part on the bridge, it has the hygienist metrics, and you can search for your own office what your metrics are, and they keep it pretty simple. Green, right, is good. Red is where there's an opportunity. So if you're goal oriented, you could work with that to get that red up to the green, or take your opportunity to help make that metric move in a certain way. If you're not into that, that's all right. I don't send, unless a hygienist asks, I don't send out emails saying you need to improve your metrics. If Alexa says, hey, I want to know what my goal is, I will send it to her, no problem, in an email. But if that's not your way, that's perfectly fine, because hygienists do what hygienists do best by treating the patient. So if you're focused on patient care, your metrics will follow, and they will be green or good. It's more about what's right for the patient, and then metrics or revenue follows. It shouldn't be the other way around, and it never should be the other way around.
Good. So another question is, you know, how do you discuss, Alexa, when you're talking to patients? You know, a lot of times it's like, okay, what's this going to cost me? How do you discuss price with patients? Do you discuss price with patients, or do you have other team members? And how does that flow go for you?
Yep. So I don't typically discuss price with patients just because there's too many variables that can change. So we have somebody in our office that specializes with insurance and, you know, all those things that factor how much their treatment is going to cost them. So I just have the conversation and tell them the treatment they need. And I do have people ask all the time. They're like, okay, but how much is this going to cost? And I'm always like, you know, we have somebody who's going to take really good care of you and go over that with you. I don't specialize in insurance, so I'm going to, you know, sit you down with my office manager, and she's really awesome at all that. So she's going to go over the cost with you. And it keeps things simple, because it's hard when, you know, my specialty is gum disease and, you know, hygiene, and my OM specialty is insurance, and she's really good at all that. So.
Do we do implants in our offices?
We don't do implant placement in our office, but we refer out for the actual implant, and then we put the crown. We work with the oral surgeon closely, and then we place the crown afterwards.
And that is provider specific, excuse me. So Alexa's office, that's how it works per her owners and doctors. However, there are doctors that do implants. It just depends on what office you are working at and who the owner is, how comfortable that owner feels or clinician doctor feels in placing the implant.
Okay. And how about oral surgery? Do you guys have an oral surgeon that comes in the office?
Currently in our office, we don't have an oral surgeon that comes in. One of our doctors is comfortable with doing a lot of surgery cases, like full mouth extraction. So, I mean, we do have a decent amount of surgery done, but we don't have an oral surgeon in the office currently. And we refer out for like wisdom teeth and things like that.
And Tiffany, that's, again, go ahead.
Yes. So also it would depend on the office and maybe the need for it, right? So that dentist is very experienced and feels confident doing that. There are, within Aspen, there are oral surgeons and endodontists that travel around to different offices and work certain days to help doctors, general dentists, that maybe don't have that confidence or ability to do that. Then they can have that root canal or extraction with the oral surgeon if the doctor doesn't feel comfortable doing it. Or, as Alexa said, they can get referred out too.
Okay. How about orthodontics? Do we do any type of orthodontics in our offices?
We love orthodontics in our office. So yes, we currently are doing Invisalign with the iTero. It's been so much fun just seeing people's before and afters, and you know how happy they are after we straighten their teeth out. So ortho's been a good fun thing for our office. So yeah.
And how about children? Do we see a lot of kids, any type of pedo?
We do in our office see a decent amount of pedo. We like seeing pedo in our office, so it keeps things interesting. So
yeah, we didn't in our office. So again, you know, it's all, you know, we had an office in our area that was, you know, they did a lot of prophies because they had a huge, it was Penn State University. So there was a lot of college students there. And so sometimes, you know, it depends. So generally, and I think this is important for people to understand what our typical patient is like, and maybe sometimes why people, you know, for Aspen, that you see complaints, and it's because there's a certain type of patient that we generally see. And Tiffany, can you explain that the general type of patient that we see on a regular basis at
Yes.
Aspen?
So typically the patient we see is an adult, middle to low socioeconomic status with, if you're a dental provider, low dental IQ. And typically it's been multiple years since that person has been in the office. And what we stand for is, okay, you're here now, let's get the treatment that you need. We're not going to sugarcoat your diagnosis. We're going to tell you what you need, but also give you the ability to get back on track to be healthy. So a lot of times patients will come in, and it's been so many years, they're embarrassed. They literally try to say, I don't want to tell you how many years it's been, because, you know, it can be embarrassing. But as providers, what we stand for is first of all, you can't shock me. Second of all, you're here now. You start today. Let's just talk about what you need now. Our patient base is just like veterans. It's high needs. It's typically perio patients, gingivitis therapy. Alexa can attest to it. It's not that we don't see kids or healthy mouth patients. It's we just allow a different opportunity for patients that are basically caught with, sometimes they haven't had insurance, and they need a way to pay for years and years. We're talking like a decade of neglect. How do you afford that? So we offer that opportunity through access to care. We're bridging that gap.
Right. And so I think that's really important to explain to people, because, you know, you can almost understand that a person who has not seen the dentist in a really long time, and because we have the extended hours and we do, you know, we try to say yes every day if a patient comes in and fit them into our schedule. We do see patients who haven't been to the dentist in a long time, and therefore the last time they saw a dentist, maybe 10 or 15 years ago, were cleanings. Okay. And so what people come in, they want a cleaning, but they don't realize, because they haven't been told that they have gum disease. They haven't been told that, you have cavities. So cavities happen over the years, and now their mouth is to the point where they need a full mouth rehab. And so when people say, oh, Aspen was so much more expensive, no, it's not that. It's just that the people that are coming on a regular basis have a larger treatment plan because they haven't seen the dentist. So that's an important aspect here to let people know that's our typical type of patient. So how do you guys, and I'll let you both answer this, how do you deal with negative thoughts about Aspen, or when you hear negative comments, or what do you do in that aspect? Because I know that's a concern too. People say negative things all the time, and they want to know how to deal with that. So how do you deal with that, Tiffany?
So how I deal with it is, first of all, Aspen's pretty transparent. So just like any other private company, whether it's one single office or multiple offices, we put multiple things out there, including on Facebook. So then we, in return, or Aspen in return, can have criticism one way or the other. And really, it's just, are you a good fit with the office and as a hygienist, and what are you doing? Alexa's hygienist, one of her hygienists, Courtney, actually, when we offered for her, she declined. And she said that, I'm concerned that ADMI or Aspen's going to come in and dictate what I should be doing. And I'm concerned about that aspect. And I've worked in private practice. I don't want to do that. And I said, Courtney, I promise you, if that happens, if I come there and do that, your Dr. Schneibel will politely but firmly kick me out of the office. That's not going to happen. And I'm confident she's a happy employee.
Perfect. Yeah. How about for you, Alexa? Anything else that you might, if you come across people, oh my gosh, you work for Aspen Dental. I've heard that, and I have my own way of dealing with that, because I feel very strongly about Aspen and the mission and the, of what we do every day. And how do you deal with that?
I would agree with everything that Tiffany said. And then I kind of, I know that I'm doing what's best for my patients at the end of the day. And I've been put in a position where I feel fortunate enough to see people that haven't been to the dentist in a long time. And for the majority of those people, I'm there to make them feel comfortable and make them at ease so they can, have a good experience. And, I'm just doing the best I can to make those things happen. So
good. And, and I love to get my 2 cents in here, but, I tell people too, sometimes, we're as good as the people that we have there. So, that's who we look for. We want the best, because that makes our offices the best, and we don't tolerate, we have 850 offices close to. We're not always going to be perfect, but that's why Tiffany's here in her role. And, and Alexa, you're the lead in your office, Alexa?
Yeah.
Yes. And in those kinds of roles is to make that happen, and to make sure that people are getting the care that they deserve. And so I tell people all the time, we are transparent. All we want you to do is come shadow us. We don't hide anything. We have nothing to hide, and so I love that part about Aspen also. So we're going to get to my final question here, and that is, Aspen is a yes organization. So, we say yes today, yes to treatment. What does that mean to you, as far as your position and how that has impacted you, and anything else that you might want to add in there, Tiffany?
So as a yes organization, for me as a hygienist, that means that when a patient comes in the door, let's say we have a last minute cancellation. Can we see that patient today? Are we offering that patient that service? Another thing is of course I want the patient, I'm a firm believer in fluoride because it reduces sensitivity to temperature, it reduces carie risk, and I have an electric toothbrush, why shouldn't everybody else? However, if a patient is backing out on something for a home care tool that I know that patient could benefit from, I don't want that patient leaving with nothing. So for yes today means did we explain to the patient what his or her prognosis or diagnosis is and the treatment plan, and then can we work through those barriers, whether it's financial, whether it's just the patient doesn't understand, but something. I don't want that patient leaving, walking out the door and going to a different dental clinic. I mean, I feel like then we failed that person. So that's what yesterday means for me.
Good. Alexa, how about you?
For my yesterday, I mean, it's kind of piggybacking off of what I said earlier, just that I feel like I'm being put in that position to help those patients and just really give them that good experience, and just, you know, waking up every morning and, you know, yes, I'm going to do my best. Yes, I'm going to give this patient good experience, and, you know, just doing the best I can as a team member, and hoping, you know, helping my team members, you know, work through any barriers they have as well with patients, and so everybody can have a good experience at the end of the day.
Great. Yes. And for me, yes, today is, you know, it gave me a chance to renew my love for hygiene. I really kind of was losing that after 19 years. And I felt that I wasn't, you know, I was kind of held back in my career, and didn't really know where I was at. I was kind of burnt out. Came to Aspen, and I just fell in love with hygiene all over again and their model. And it's allowed me to grow in my career to places that I never would have expected. So outside of clinical hygiene, there's a lot of growth in Aspen, and, you know, and they really do care for their people. The culture is second to none. So I want to thank you both for joining me. I appreciate it. I hope to work with you again, Tiffany. I'm sure I'll see you in passing, but thank you very much. And I appreciate your time, guys.
Thanks, Holly.
Thank
Thanks,
you.
Tiffany.
Bye guys.
Bye, guys.
Thanks, Alexa. Bye, Holly.
Bye-bye.